Hi, I'm HME News Executive Editor Mike Moran. I'm here today with Kelly Riley, the Director of the Med Group's National Respiratory Network. And we're going to talk about opportunities in the sleep market, Kelly. I mean, it's such a big, growing market. It almost seems like there's no end to it, but there are opportunities out there that providers probably aren't taking advantage of. I mean, what are some of those things?
I think the biggest opportunity that we see in the sleep market right now is the fact that the public is still so unaware. And I'll give you an example. Recently had a colleague that is very involved in the sleep business, very involved in the industry as a whole. And he had even gone so far as he knew he was a snorer. And so he thought he was taking care of the issues and said to his wife, "Now, do I ever stop breathing?" And she said, no, you never stop breathing. Well, we at Med have been on a mission, so to speak, to internally make sure that we identify our own staff members who might have obstructive sleep apnea. So we were able to facilitate some screening, and his apnea-hypopnea index, in fact, was extremely elevated. So while he did not have apneas, he certainly had a very elevated level of hypopneas. And in fact, and he's told me that I could share this, his apnea-hypopnea index was in fact 85. So that he had very severe obstructive sleep apnea. So that's a lesson in itself right there, that again, we think awareness is being driven, and it is, of course, much more so than ever before, but it is still, we're still missing the mark. And that's the opportunity for HME providers. HME providers have an incredible opportunity to really dive into the data, the clinical data related to the management of sleep disease, and to become passionate about promoting public awareness. We have seen huge case after case after case of patients who go to physicians, and physicians will again, they're still not necessarily misdiagnosed. Just again, there's just not yet that awareness out there. The patient goes in for example, a knee surgery. They're going to focus on the knee, but yet the patient is 5'10", 300 pounds, 19.5-inch neck. And again, we say we're streamlined in our American healthcare system, but we are still missing the mark, and certainly not only HME providers, but across healthcare systems. So HME providers, because we are so much in the public, often, especially with our stores, for example, that have retail locations, we are oftentimes invited to participate in public events where we can help promote awareness and empower people to not always take maybe the first pass of information, to be, and we're finding this all across all spectrums of healthcare, to take a more active role, and HMEs are just in a great position to provide education in that way. And the other opportunities for HMEs...
Would it be, for example, might you drop something off at your referral sources offices, or like primary care physicians? I mean, is there an opportunity to do it like that? Or
in fact, I'm advocating that instead they involve themselves in things like community health fairs. Community health cares, there are civic organizations who are always looking for speakers. And they could, example, we see a growing trend in postmenopausal women taking 10 years to be appropriately diagnosed. There's women's clubs and groups out there that are always looking for a speaker. We see a huge increase in the number of pediatric patients who are now suffering from obstructive sleep apnea. Obesity is increasing across all age sectors, and we are seeing an increase in pediatrics. So again, there's an opportunity there for those groups that that focus on children. There's just a lot of, and if we establish ourselves in the community as the go-to experts in sleep, then we're going to get the business, and we're going to be identified as more than just looking to move product. And unfortunately, too many physicians and referral sources see us that way, and we need to, I feel that we should step up and really become passionate about promoting awareness, as many of our manufacturing partners have done. So now let's take it to the next level, because we are the ones who we are in our communities. We have opportunities sometimes for talk shows, those kinds of things. So there's a lot of opportunity out there to empower patients, and the patients are the ones then that are going to drive the market.
Yeah, that's true. I mean, build public awareness in your own community, become the go-to person, and that will translate into business. But it's a very, yeah, it's logical, and people need education.
People need education, and you know, it sounds a little funny to say, but you know, for a long time, one of the things that you hear people say is sleep is the new sex. Yeah. You know, it's the new trend thing. If you look at the television any night of the week, it's all of the promotion for sleep products, and we're going to help you get more sleep. We're going to help you get to sleep faster. We're going to help you sleep better. How is your sleep? Are you getting enough sleep? And we should take advantage of that. We should absolutely take advantage of that, because you know there's that awareness out there, and we should jump on those coattails and get some leverage from that. And you know, things like one of the things that I talked about in my lecture this morning is a lot of people say, wow, I've really got a great program, and I challenge them, define that for me, because if you are not defining your program by patient outcome metrics, I feel that you're missing the mark. And so we all know, most of us know, that the compliance metric that CMS set is certainly from the Krebs study, that we know that's the greater than 4 hours metric. And if that's what we're going to use, great, but let's use something, because there is not a truly recognized metric scientifically that says this is the magic number. So across our industry, within our providers, we need to decide ourselves, what is our metric going to be for compliance? Is it going to be the same as what the Krebs study is, since we're collecting that data anyway? And if it is, then let's start measuring it. Let's memorialize it to our staff, our patients. Tell our patients, hey, currently our company is at a 95% compliance rate. We are very passionate about promoting patient outcomes, and your numbers will be included in this data in the future. That helps promote both awareness and ownership. They become a part of something bigger, and it helps make them think about that day that they're not maybe going to decide, oh, I don't want to wear my mask that day, because again, they're going to know that they're going to be part of something larger, so we want the suppliers to then articulate that information clearly to referral sources, say, this is what we measure, and this is where we are. And I think there's a huge opportunity if we start focusing on the science of sleep.
Great, then. All right, Kelly, thank you very much. It was interesting.
Oh, you bet.
Okay.
Yeah,
bye.